Right, we're going to get started. Hello and welcome everyone to your webinar on supplement safety and efficacy with Dr. Secor of Hartford Healthcare. My name is Elena Watson, your health fitness specialist from the Virtual Fitness Center. Please remain muted, type any questions you may have throughout the presentation into the chat box. And at the end, there will also be some time for questions as well. That is it for today. I'll pass it over to Dr. Secor. Thank you guys so much for joining.
Great. Thank you guys so much. Everybody can see the screen and hear me okay?
Sounds and looks good.
Excellent. So, this is a topic that I'm very interested in and passionate about. Before I came to Hartford Healthcare, I spent 10 years at UConn, basically focused on research specifically in dietary supplement areas. So I worked in the immunology department, focused on anti-inflammatory effects of a lot of different dietary supplements. Some of the questions that came in, which there was many, focused on some of the supplements that I have been doing some research on. So I hope some of those questions will be answered throughout the presentation. And then we're going to try to leave plenty of time to review some of those questions and have some answer time near the end. So I'm just going to jump into things. And I help oversee integrated medicine and wellness for Hartford Healthcare. This is my 10th year at Hartford. I was at UConn 10 years before that, did a stint at Hospital Special Care in St. Francis, and then I did a 3-year internship in private practice. So I'm coming up on about year 25 of practice soon, which I can't believe. So overall, my goals are to review supplements, step back and make sure that everybody's on the same page when it comes to definitions, categories, and understanding what these things are. This may seem oversimplistic, but it's good to get to level set and make sure we're all talking about the same things. I am very, very cautious about quality control and having you understand the life cycle, and we'll look at a couple of labels so we can understand what a recipe is and what a dose means. Hopefully this will be applicable to many of your questions and all of your supplement use in the future. I want to discuss 3 major categories that are the most potentially dangerous that are out there and have the highest side effect profile and interactions. And then I want to review for you kind of my top 10 supplements, but also laboratory identified nutrient deficiencies that I see almost every week and every day in practice here at Hartford Healthcare. And obviously we're going to leave lots of time for questions. Let's see here. I'm just going to close off some of these messages so I can see. Just so you guys know, it's difficult for me to see the first inch. So if I mispronounce something, I apologize. But I think you all know this, that dietary supplement use is high. Over 40% of people use these to treat conditions as a primary mechanism for treating healthcare. Well over 85% use natural products regularly. There are distinct populations of patients that this value is even higher. My cancer patients, my arthritis patients, my patients with autoimmune conditions, sickle cell pain, with those patients, it's up over 100%. And obviously we use other forms of integrated medicine modalities very widely, such as yoga, manipulation, etc. When we just talk about what a supplement is, dietary supplements were actually coined by Congress in 1994. They passed a law called the DSHEA, Dietary Supplement Health Education Act. And this is one of the first times we actually put into writing what a supplement is. And this includes vitamins, minerals, herbs, botanicals, amino acids, and other substances which are important. And they are intended to be taken by mouth as a pill, capsule, tablet, or liquid. And it should be labeled as such on the facts panel as a dietary supplement. This is very controversial. There's a couple of reasons why. Many of the supplement industries, a large percent, are in Utah. I think they have over 150 companies now. That was sponsored, this bill was sponsored by Senator Orrin Hatch, who is a Republican of Utah. So there was a little bit of industry controversy at the time. And when this was written under DSHEA, supplements are food. And this is an important distinction. Many people are confused and feel that supplements are regulated the same as FDA approved prescription medicines, and they are not. And so under DSHEA, they are food-like substances, and the companies really self-report adverse effects. And that's why this is a sort of a controversial bill. This is a really good paper that I cite. It's a little bit older, but it's okay. It talks about the use of complementary health approaches in the US. This is an NIH funded trial. They looked at about 90,000 adults, and they asked the question, what do you use? What do you do over time? And they looked at 3 time points, 2002, 7, and 12. And they said, what is the most common wellness or integrative medicine modality that you participate in regularly? And the results are that non-vitamin, non-mineral dietary supplement remained the most popular health approach used. And again, this sort of echoes what we saw in the previous slide, that this is of high use. And importantly, focus on the non-vitamin, non-mineral. So this technically is not, as some of your questions asked about vitamin D and iron and forms, these are not vitamins and minerals, but these are other things like oils and DHEA and turmeric. So again, it is the most common modality used. And when we look at the numbers, we don't have to get into the details of the data, but when we think about some of the top products, fish oils and glucosamine and chondroitin and probiotics, prebiotics, melatonin, CoQ, echinacea, cranberry pills, garlic, ginseng, ginkgo, green teas, ECGC, that's the catechins, epicatechin galates, combination pills, which I'm going to get into, MSM, milk thistle, saw palmetto, valerian, etc. And so many of these did go up in usage over this time frame. You know, when we think of this in terms of an industry, and we think about these categories, it's not just dietary supplements. It's herbals, botanical products, traditional folk formulas, which are becoming more popular, particularly in the TCM, traditional Chinese medicine, Ayurvedic, Indian medicine, Unani, African medicine, Japanese medicine. So there are many traditional formulas that we're seeing. Also homeopathics, again, probiotics are exploding, and food-based phytochemicals. And so this is also a massive marketplace. And when I think of this, I think about medical use, functional foods, beverages, and it has a sustained significant growth rate, and it will continue to grow. And I think when I look at the sentence at the bottom, what I'm always concerned about, when we take all of these products and vitamins and supplements and botanicals, and when we put them into our foods, our beverages, what we should be considering is, are the addition of these natural products providing added function, and are they safe? When we think about why should we care about this, and you know, why is this even a concern to us? If you look at the major players who are doing this, these are the largest food manufacturers on the planet. Pepsi, Coca-Cola, General Mills, Kellogg, Kraft, etc., Dannon, you know, and they are making what we call these key functional brands. Vitamin water, Gatorade, Yoplait, Activia, right? Take the Activia challenge. I think it was a 30-day and 14-day. So what we're doing is we're taking products and probiotics and activated B vitamins. We're putting these into foods and drinks, and we are making these functional foods. And again, why? Because us as consumers, we want better energy, heart health, bone health, gut health, sexual function, vitality, anti-aging. So we are the ones driving this. We're also the ones driving these major manufacturers to look at these categories And instead of doing R&D for 10 years, they can add something functional and then pivot their product and market it. And again, as we add all this stuff into all these products and as this area explodes, are we getting better benefit from these foods and are they improving our health? So part two. So we looked at what is a supplement. We looked at some definitions. We looked at some categories. We looked at some industry. Now we really want to move into a deeper dive into the importance of quality, life cycle, ingredients, and recipes. This is one of the products that I commonly used and researched for about 10 years called Bromelain at 9 o'clock. Bromelain is a pineapple stem extract. And when I did research on this NIH-funded research, I had to basically be aware of this entire life cycle. So I had to identify, where is this product grown? Bromelain is a stem extract. It comes from the pineapple. Somebody was growing pineapples. Somebody has to export the pineapple, or somebody has to extract this activated product bromelain from the mature stem. So we have a grow and a process at 12 o'clock. And this is the same for every natural product, every bottle, every ingredient that we are looking at in these products. Somebody's growing it, somebody's processing it, and then they have to verify, is this product safe? Does it have contamination? So the grower and manufacturer basically have a middleman, sometimes called an exporter or importer, and they provide what's called a COA, Certificate of Analysis. And so that COA, which we're going to review one later, is that piece of paper that says, is this a good product? The grower and manufacturer says, trust me, this is a great product. You can trust me. And then we import it. And the key issue at 6 o'clock is, I'm a small manufacturer. I make dietary supplements. I'm getting this product, Bromelain, which is a pineapple stem from Bolivia or Hawaii. And I'm trusting that the certificate of analysis is accurate. Do I quarantine the product? Do I do more quality control testing to verify it? Or do I just trust the COA and then push it into the cycle? And this is the real nuance of quality control in manufacturing. Whether I quarantine it, retest it, or I believe the certificate of analysis, that product now, that ingredient is going to go into the blending, bottling, and then it's going to go right into sale. And so this is an important cycle that happens for each ingredient. High quality manufacturers will quarantine that raw material. They will test it. They will blend that ingredient with many other ingredients in a product, and then they will retest it, and then they will put the product out for sale. And again, when I do research, I was responsible for this entire chain of everything that I researched. And if the FDA or FTC audited me, I have to provide proof. Where did I get it? Who identified it? What was the testing? And did I quarantine it? Did I retest before I engaged in research? And again, FDA, again, this is food. The FDA has suggestions, which are good manufacturing practices, GMPs. These manufacturers, in a sense, voluntarily comply with GMPs. And then when it comes to the FTC, the Federal Trade Commission, the FTC is about label claims. And so we'll get into this label claim thing in a minute. So when this product comes to you and you go to Whole Foods or wherever you're shopping, you have to be thoughtful of, is this a good product? Is it a good ingredient? What does the label say? And do I trust that in the background of this product, all this is happening appropriately? I'm not going to go through these in detail. These are just a couple of tables from a chapter that I wrote last year, one of the medical nutrition textbooks. I know it's very exciting. But in box 431, I just wanted to remind you that There are many different types of products and many different types of forms of these products, from bulk herbs to capsules to essential oils to extracting to decoctions. So when I look at a product, I'm trying to understand, what is the person or the patient in front of me trying to accomplish? What do we think may benefit him or her? And then what is the form of the product that we think is most advantageous or efficacious? Upper right box, I think that's 43.2. I can't see the header. Ask yourself, why am I taking this? Who suggested it? What are the indications, the dose, the duration? What's the optimal form again to take? Are there safety concerns, laboratory tests? And do I have clear expectations of outcomes? And I'll touch on this later, and obviously potential side effects. And obviously there's a discussion that you have with your physician. Some of them who are proactive and progressive will engage you in discussions around this in an inquisitive way, instead of talking down to you, because many of these products do have data and many of these products are beneficial to health. So we should be engaging with you in an appropriate, inquisitive discussion, not a demeaning discussion as we discuss this. So getting back to our bromelain, and when we went from the product here at 9 o'clock, that's our bromelain. And now we're actually looking at the label and we're asking ourselves, what the heck is this bromelain? Is this a good product and should I take it? Now you're asking yourself, bromelain, what the heck is it? Well, bromelain, you have to know what is its function and what does it do. Bromelain is basically an enzymatically active extract. And so its strength is based on protein digesting activity, what's called GDU, gelatin digesting or milk clotting units. So when I look at bromelain, I understand what the extract is. I understand its activity. It's a digestive enzyme, and I understand its strength. So optimal dose is 375 to 500 milligrams. That's the amount. And then the strength is the GDU MCU, 2400, 3600 of pure uncut gram of bromelain. Sounds like we're doing drugs here, but it's an important thing to understand. So let's look at the left-hand supplement facts. And we're trying to decide, we're at the store, we're trying to decide, is this a good product? So I'm looking at this, I see some calcium carbonate, I see some glucosamine, I see this proprietary blend of some green tea, bromelain, and ginger. So when I look at this product, I understand that this is for bone health and that this might be a mild anti-inflammatory. But the question I have is this proprietary blend. This proprietary blend has 315 milligrams of something, ginger, bromelain, green tea. It could have 5 milligrams of bromelain. It could have, 300 of green tea and 10 of ginger. So the point is, when I see proprietary blend and I don't know the amounts, how do I dose this for myself or you? Because I don't understand the amount. If we go to the one with the star, we understand that this one has how much? 750 milligrams per capsule. What is the strength? 2400 GDU. So when you're looking at that capsule, that facts panel, you understand that, geez, I should be getting, the doc said, hey, 375 to 750 a cap. I should have a certain strength. So if I'm going to do a trial on this for joint pain or blunt trauma pain, I know that I have the right dose, the right strength. Then I can get engaged in taking that. Then you have to look inside the product and say, what the heck is the quality, the consistency of bromelain, for example. This is the table of one of my old papers at UConn. And basically, I, again, did quality control of every single lot of this product. So we're exploding the label. We're looking at bromelain itself, and we're asking the question, what is the quality control data? And you can see it's pineapple up top. It's the mature stem. You can see its activity is over 2400 in the burnt orange bar. And then it's tested. It's tested for solvent residues, hexane, xylenes, microbial components, E. coli, salmonella, alpha toxins. It's coded for heavy metals and pesticide residues. So when I was looking at these products for 10 years, I rejected numerous lots from wholesalers because they were either too low potency, high potency, or they had benzenes or they had lead. So the point is, when we look at the label, we have to say, what's the product, what's the dose, what's the form, what's the amount, and then we have to say, what is the quality of the product, and did they do QC testing on this product? I'm not going to go through this for you, but these are the questions that I ask manufacturers, and these are the references of high quality references for you that gives you opportunities to look at the databases around to understand how do I assess high quality resources, how do I assess high quality data at our national level and Consumer Health Products Association. I think one of the last things in this section I want to talk about is just the idea of labels, label claims, and these ideas of seals. And I think you can watch the TV and say, I trust this product because it was the first product to use a USP seal, or it's backed by Consumer Labs or NSF or UL. And so what I want you to realize is that these seals are granted by organizations that certify the products. None of these organizations guarantee the therapeutic value, and they don't even test every batch that's put out. But the importance of these is that at some time when this product went through this testing, they looked at, does it match label claims, and is there any contamination in the product? So are these seals a benefit? Yes, they give you a little bit more beneficial information that it was tested. Now there's controversies here because some manufacturers pay large amounts to get tested, $3,000 to $15,000 per product, and then there's audit fees. And so you can see that this is not a perfect scenario, and really no seal is a guarantee. However, it is probably better than nothing if you're asking the question, where do I begin? What do I think a good product is? Before I leave this category, a lot of my patients get irked with me because they bring in all their products and we look at them and I'm trying to understand, what are you doing? What are you taking? What do we want to achieve? And then I'm trying to understand, how do we guarantee that this is a safe product? And many times what I do is I will call the manufacturer and I will ask for the quality control spec sheet on that product. And that quality control spec sheet, whoops, I'm going the wrong way. That quality control spec sheet will actually look like this, a COA or a secondary analysis, and it will come out with all of its general information, specs, results, and methods. And so very often that product spec sheet never shows up. So, if you want to guarantee that the product is good, you'll call and say, Dr. Secor said, I need the quality control for this lot. If it never shows up, then all we're doing is trusting it's a good quality product. Okay. So let's pivot and let's get into a little bit about, start talking about individual products, some that I don't like, the reasons why, and then we're going to get into some of the top 10 and hopefully leave some time for all your questions. So I outlined it for you. There's 3 categories that are very controversial, and some of your questions related to sports performance, weight loss, sexual enhancement. These are product categories that if you're up at 2 a.m. and you're looking at the surfing on the TV, these are generally the commercials that you see. These are generally the ones that you should not buy. And hopefully I will convince you why. First, I have a question for you. Based on your in-depth knowledge of supplements now, you are going to sell this QCAN Plus. This is a new fermented soy beverage that is going to be imported from China. The manufacturer says, hey, here's the COA, the certificate of analysis. I want you to trust me that this is a great product. So you are deciding that, all of your up level or downstream Raytheon employees are going to take this fermented soy beverage, and you're deciding, is this a good product? Do you trust the quality control of this product, or do you reject it? So I want you to think about that, and we'll come back to that at the end. This is a study I ran for Yale, so I actually ran all the QC, and I know the answer to this. Okay, let's get into some product categories. There's a reference I gave you, FDA alerts and advisories. You know, this is the exciting stuff that I look at on the evenings and weekends. I surf and say, hey, what's the newest FDA alert on these products? So we're going to go through a couple. This one is called Hydro Pineapple Burn, right after my own heart of the pineapple. This is sold and marketed for fitness and weight loss. So FDA laboratory analysis confirmed that this contains an appetite suppressant, sibutramine, that is off the market, Meridia, excuse me. So again, you have a product marketed for weight loss and sports enhancement. It is adulterated with a prescription medication appetite suppressant. This is the 365 Skinny, high intensity again, fitness and weight loss. This is from Emergency Boutique, and you probably guessed it already. This also contains an appetite suppressant, sibutramine. So again, what we call this is adulterated with a prescription medication. Here's another one, Alpha Male Plus, Alpha Beast, and these are from Alpha Beast Incorporated. I guess you realize that this is for sexual enhancement. And when we look at this, of course, this contains Cialis. So this again was adulterated with a prescription medication, unfortunately. My other three favorites, Max Zen, Premier Zen, and Perfect Zen. These are from a company called Miracle 8989. And again, these are for sexual enhancement. And again, these contain Viagra and Cialis. We have Miss Slim. You can lose an average of 6 pounds in 10 days. You get super fast results. This contained an appetite suppressant. Again, pink bikini and shorts on the beach. How could you not want to take this? This was sold by Lucy's Weight Loss Systems. It was recalled because it had an appetite suppressant and an OTC laxative. This is Boss number 6. It had Cialis, and I have a lot more. So the point of this section is just for you to realize that there is a group of categories of supplements that may be adulterated with prescription medicines to give you long-lasting, quick, powerful results. And very often these products contain prescription medications, either that they're adulterated or they're no longer, they're taken off the market, prescription medications, because many of these are manufactured out of the country. When we talk about not only the dangerous categories, but when we talk about potential interactions, people talk a lot about interactions of products. And so I have a couple of slides just to set the stage for you when you think about interactions. And so there are a lot of theoretical interactions versus actual clinically defined interactions. For example, Camellia sinensis is green tea. Now, those of you who are not up, those of you who've done 23andMe in your genetic analysis, you probably recognize some of these things because these are enzymes that your liver uses to detoxify or process all your medications. These are called CYP, cytochrome P450. So basically, in theory, green tea gets metabolized by your liver via these three enzymes, and they may have interactions described in animal models. But clinical studies on healthy volunteers showed no interactions with these enzymes and only a minor increase in one enzyme. So we use cell culture and animal trials to try to understand what do these products do And then when we try to translate these into human clinical trials and ask the question, when we take a product like green tea, does it activate, downregulate, upregulate our liver enzymes? And we're not really seeing profound interactions like that. Similarly, with echinacea, is a very common product used for seasonal allergies, for immune support. And they talk about, again, this liver enzyme CYP3A4. And basically, we have a lack of reliable, drug interaction reports and clinical trials in the literature. I will say that any of my patients who are on life-sustaining medications, whether it be chemotherapy agents, autoimmune agents, if they had an organ transplant, any of my patients or their family members that are on very significant medication that they require for life-sustaining purposes, that should flag us to say, okay, let's be extra diligent. Let's talk to the pharmacist. Let's talk to our doc, because all those medications, many of them are metabolized by about 10 key liver enzymes. And these liver enzymes, like the CYPs, also metabolize all the natural products that you take. So when you're thinking about drug interactions, and again, those of you who've done your GeneSight or you've done your 23andMe health survey will know that you have certain of these genes that may be slow or they may be fast. And those are important things to think about as you think about your medications and also potential side effects when you add other medications or natural products. But overall, for the general population, we're not seeing a heck of a lot of interactions in these categories. So now I want to go through, and this will take us into a lot of the questions, sort of, the top 10 things that I see in my practice when I talk about daily dietary supplements. Everybody asks me, what should I take? How much vitamin D? Do I need iron? What form of iron? Should I be on B12? Do I need calcium, vitamin K? So what I do in practice, the majority of the time, is I don't guess, I test. And so I just want you to take a minute with me and we'll look through the top 10 supplements. And basically, these are the ones that I see almost every day, every week with somebody, with my patients, and they're either deficient or they have an excess of this. So these are the ones that I test regularly. And again, top 10 nutritional deficiencies or excesses I see almost every day. And again, the important take home is that most of these can be corrected. We test the levels, we decide on a dose and a form. You do that for 3 to 6 months, and then we retest and adjust. This is kind of the gold standard that we should be following, because there's other things that affect your levels. Do you have issues with diet quality? Do you have issues with stress? Do you have issues with gastrointestinal absorption? Many of these can affect your absorption of these amounts, and we may have to adjust doses accordingly. So let's get into this quickly. Vitamin D. I think there was 3 or 4 questions about vitamin D. Does it matter? Do I care? And so, vitamin D is one of the easiest things to check and one of the easiest things that we should be fixing in the country. There is no reason for any of you working at the place that you work at the high quality, technology and high-end work that you do, none of you should be vitamin D deficient or vitamin D excess. Vitamin D has many, many forms. The 2 most common are ergocalciferol and cholecalciferol. When you look at your supplements, you'll see that cholecalciferol D3 is over 80% of the supplements out there. Why would you be deficient? Well, you could have poor diet. You could have post-bariatric surgery. So many of my patients who've had a bariatric surgery for weight loss have malabsorption. Vitamin D is fat soluble. You could have celiac disease, inflammatory bowel disease. You could have fat malabsorption, pancreatic insufficiency. Again, an unbalanced diet. So many of those are reasons why you may not be taking in vitamin D and importantly absorbing it in the intestine. What signs and symptoms may you have? You may have bone pain, tenderness, muscle weakness. Obviously, we all think of low bone mass, fractures, reduced absorption of calcium, phosphorus, hyperparathyroidism. So vitamin D, we used to just think about for bone. There's many, many other things that vitamin D does. So what do? I test, dose, retest. This should be fairly easy. And I think a couple of questions were, why should I take vitamin D? What do you think of all this vitamin D supplementation stuff? It's fat soluble, yet we test our blood for it. Is it possible we are overtaking it? It's a really, really important question. And I'm not a mind reader. I don't know what the average person is taking, but one thing's for sure, if you test, you'll know, and then you can dose and then retest. Again, those people who are going out in the sun, many of us are not going out in the sun to the degree that we used to. So that's not enough to raise our vitamin D if we're deficient. Okay. And a couple of things I gave you for reference. I gave you a paper on malabsorption. That's not important. But that blue reference, and you'll get the slides on this later, that is your NIH, National Institute of Health, government fact sheet from the Office of Dietary Supplements. This gives you like the basic information. What is the supplement? What is the dose? What should I be doing? What does it do? So this is a very nice conservative resource from the government, and it's a great place to start for consistent information. Oh, that's the question. I started putting all the questions in and there was too many, so I stopped putting the questions in. So what do I think of it? Again, if you don't test, you don't know. And you're right, it is fat soluble. So testing the blood for it is okay. We can test the blood and we can get an accurate value. And then if we dose it over 3 to 6 months, we should bring that value up. And often for some people, I get to the place where they have to take it maybe, Tuesday, Thursday, or Monday, Wednesday, and Friday. So again, it's hard to know. We can't guess. And it is a little bit of, titrating, but again, important nutrient, overlooked, sort of dismissed by many of the medical community, but many of the good doctors that are practicing today will actually test it for you and help you get a dose and make sure your values are up. Omega-3s. This is a very, 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 very important supplement and category. This one, every day there's omega-3 deficiencies. I do an omega check with Quest Lab and I check EPA, DHA, and I'm asking the question again, what is your essential fatty acid ratios? Omega-3s are your polyunsaturated PUFAs, 3s and 6s. In general, I say in general, EPA, think of that from plants and fish and microalgae, DHA, also fish and microalgae, cold water fatty fish, salmon, mackerel, tuna, herring, sardines, you probably know that. Why would you be deficient? Again, the whole thing about malabsorption syndromes. How's your GI system? Do you have celiac, chronic inflammatory bowel disease, constipation, diarrhea? We in the United States have the worst GI systems of anyone in the world. That's why we take the purple pills, and that's why we take, magnesium. For some reason we can't seem to regulate our bowels. And again, low dietary intake. The research on benefits are all over the place. When you do an omega check in Quest Lab, they basically say if you are deficient, you are at higher risk of poor heart health. If you are deficient, you tend to have higher triglycerides. There are many observational studies that are trying to understand what is the role in cognitive decline, Alzheimer's, dementia. We know that mothers who have appropriate EFAs, their infants have better outcomes. This is well defined. Birth weight, gestational age, visual, cognitive development. That's why we are putting DHA in milk, and it tastes a little fishy because we are putting this as a supplement so that these developing children get this in utero and also as they start eating and drinking things other than breast milk. And also we're looking at age-related macular degeneration. Now, again, do we know all the benefits? No. What is my rule? You shouldn't be deficient. So again, you can test, you can dose, you can look at your diet and say, you know, am I good on EPA, DHA? Am I doing all my essential polyunsaturated omega-3s? Am I doing more animal products? You know, we talked maybe a couple lectures ago about our grandparents, right? Crisco, you know, those are not your unsaturated, those are your saturated fats, the ones that are solid at room temperature, butter and Crisco, et cetera. You know, bacon fat, lard, those are the trans fats. Those are the things that tend to block up the arteries. And all these lists of potential benefits get reversed when you block everything up. So again, I see essential fatty acid deficiency all the time. There's really no reason for this. So we try to adjust some supplementation or we adjust some diet. We do that for 3 to 6 months. We retest and ask the question, is this going up? And by the way, do you feel better? And by the way, are your other blood values improving? And also rheumatoid arthritis. I didn't talk about inflammatory diseases, but obviously these are anti-inflammatories. They are the cornerstone of the Mediterranean or anti-inflammatory diet. So we need to think about this with our arthritides, osteoarthritis, rheumatoid arthritis, autoimmune conditions. Iodine. Somebody asked a question, I think, about iodine. Did I put it in here? Please discuss supplements for hypothyroidism. I'm taking about 2 drops of iodine and eating 4 Brazil nuts a day for selenium. Is there any hope to get my thyroid not to be so lazy? This is a great question. So again, I don't guess. I would run your TSH, your T3, your T4, and your iodine levels and ask the question, where are they? Are they low? Are they high? Iodine is very, very commonly deficient. And again, maybe because one of the main sources is iodinized salt. And so that's in the West what we get as our main source. And again, it shouldn't be our main source because iodine is naturally occurring in seaweeds, kelp, nori, kombu, wakame, seafood. These are our best sources of naturally occurring iodine. And so again, dietary iodine deficiency is the main cause of preventable thyroid disorders worldwide. Now, to the question that was raised, excess iodine is no better than deficient iodine. And so what we're seeing is a lot of iodine deficiency leading to hypothyroid. And then the docs are giving you T4, not correcting the thyroid, the iodine issue. And then we're seeing iodine go too high. And when iodine goes too high, we are seeing some autoimmune thyroid conditions. When we pull back the iodine and re-regulate that, those autoimmune conditions look like they're lowering. So, you know, the take home, just like everything else, how much should I take? I don't know. I can look at the RDA, but it would be nice if we tested. If you're not doing seaweeds, if you're not doing seafood, if you're not having a diet that is rich in these sources, you may have deficiency. And it would be nice to know and correct that before you pay for a prescription med that you may or may not need. Again, safety first. Hyperthyroid, hypothyroid, those both can be potentially dangerous. They involve fatigue, insomnia, weight gain, depression, apathy, goiter. When you get hyperthyroid, you can get rapid heartbeat. So these are not insignificant things. Iodine does play a role. Most doctors don't test it because they feel you get enough out of your diet. Test, dose, retest. That is the theme. B12 and folate. Every day I see B12 deficiency and folate deficiency again. I don't know why, but it may be that we're doing more plant-based diet. We might be doing strict vegan diet. There is autoimmune anemia where people have autoimmune antibodies to an area of the stomach. It runs in families. That may be one of the reasons we have B12 and folate deficiency. People can be anemic. They can have cognitive slowing. They can have confusion, fatigue, irritability, forgetfulness, psychosis. You can have ulcers in your mouth. You can have neuropathy. And you also have increased risk of osteoporosis, fractures, etc. Weakness, numbness, and pain, restless leg syndrome. Again, can I guess an answer for you? Do you have enough B? If you are doing a plant-based / Mediterranean diet where you are getting normal sources of small amounts of meat, maybe fish, maybe poultry, you should not be B12 deficient. But then again, if you're on acid blockers or constipation or your digestive health isn't great, then we could have additional low levels. So again, we need to know this. Tomorrow on Thursdays, I am lucky enough to work in neurology at Hartford Healthcare. I support the movement disorders. The physicians there are phenomenally astute at measuring all these things. And so when I see the patients for integrated medicine, functional medicine, Dr. DeMarcata, Dr. Machado, they are already running these levels. So we understand what are your levels. Very important. Iron and ferritin. I think most of you are familiar with iron deficiency, particularly on the female side. If you had a heavy menstrual cycle, heavy flow, diet wasn't that great. We obviously get fatigue. We get restless legs, headache, exercise intolerance, shortness of breath, weakness, etc. Many people don't understand that pica, which is actually common, if you have cravings for ice, for other foods that you normally may not, this can be an indication that there is a nutrient deficiency. Again, iron, there are two forms, heme and non-heme. Heme form is within our animal products, meat, seafood, poultry. Non-heme is in our plants and iron fortified foods. And our ferritin, what I tell my patients, it's what's in your pantry. So you need to take in iron, you need to store it in your pantry, and then your blood iron is what you cook with and what you make, and what's in your pantry, your ferritin, you pull out, and then you incorporate that into red blood cells, into your hemoglobin, and you do things with it. Why would you be deficient? Obviously, if your diet is not optimally balanced. Again, this malabsorption gastritis situation. Do you have H. pylori? Have you had bariatric surgery? Are you on proton pump inhibitors, Prilosec, Prevacid, Acifex, Nexium? These are the most common things we take. And yet, what do? They tend to decrease absorption of our minerals and trace minerals. So iron deficiency I see every day. And again, it's one of the most common things we should think about with fatigue, any changes in food cravings, exercise intolerance, weakness. B1 thymine, I see this every day, which is also amazing. People come in, they say, I have numbness in the hands and feet. I'm having some problems in movement. I have some neuropathy, some pain. Again, B1 or thymine is common. Historically, there's something called beriberi, which if you're a little bit older or you remember from the olden days, heavy alcohol use will deplete B1. It causes something called stocking and glove, where you have a sensation that you're wearing stockings or socks, and that's that numbness, neuropathy of the hands and feet. B1 is something that is easily correctable, but I was talking with a doc, one of the big VPs of neurology of our Chase Family Center, and he couldn't believe that I'm seeing B1 deficiency. And I think it's because of that malabsorption, chronic GI issues, and we're just not holding on to our B1. I'm going to do 2-3 more slides, and we're going to open up, and we're just going to run through questions. Vitamin A, again, I see this every day. Vitamin A itself, and then we have Pro-A, which is our carotenoids. Again, think GI, bariatric surgery, disorders with malabsorption, poor diet. Number one reason for visual disturbance and blindness worldwide. People don't realize that it still impairs the immune system. So liver, fish, eggs, dairy products, and again, Pro-A is from beta carotene, and those are all of our leafy greens, orange, yellow vegetables, red, orange, yellow, red, green. If we're getting those in our diet, we're making beta carotene. 2 beta carotenes convert to a pro A. But again, if you have malabsorption issues, you may not be converting that. Test, dose, retest, easy to fix, easy to miss if we don't know your levels. Zinc, again, important mineral. Gastric bypass, malabsorption, I know. Medications, cirrhosis, alcohol, loop thiazides, loop diuretics for hypertension. Some of your heart medication can decrease zinc. Again, in men, we can see impotence, we can see low sperm count, we can see hair loss. There's something that I've seen more with COVID, but this impaired taste, dysgeusia. And again, it affects your immune system, night blindness, wound healing, skin lesions. It can also affect hair and appetite. Very important to look at and make sure you're having it dietarily. Test, dose, retest, monitor how you feel, and then decrease dose over time. Last, vitamin K. Again, many people who are on blood thinners might be a little bit older, Coumadin, et cetera. We know that vitamin K is very important. People who have easy bruising, mucosal bleeding in the mouth or the other end, bloody noses, you can't stop your bleeding. You may be deficient in vitamin K, or it may interact with one of your blood thinners. So again, vitamin K is in leafy green vegetables. It's also made by bacteria in naturally fermenting food. Hard to know unless we test. This is down on the list, but also very important if people are coming in for unknown bruising or bleeding issues. Real quick, this is one of the best quality control products I've ever seen in 15 years. So we had a multi-million-dollar quality control clinical trial, and basically this was a great product, and we put this into clinical trials. You can read this. These are my tips when you're thinking about consumers. Don't look for quick fixes. If it sounds good, too good to be true, don't may not want to engage in that product. Look at those terrible threes. Look at those labels. Look for recognizable brands. Talk about quality. If these organizations are in trade associations, does the company have a good website? Do they have good product labels with good ingredient lists? And watch those companies, like I mentioned, they undergo changes in names very frequently. And this is some of my my basic summary. Dietary supplements are used a lot. One thing I want to tell you is that it's common to have a multi-ingredient product. When you come into the healthcare system, generally we can't put that multi-ingredient product into the Epic, into the medical record. So what's happening is we're saying you're taking a multivitamin or a multi-botanical, but at this point, there's no mechanism for us to put all those ingredients in there. So just recognize that. We care about those functional medical foods, product characterization. We care about the recipe, the amount, the form, the quality control. Watch out for those sports performance weight loss. Watch out for the colloidals down here. This is the silver guy who took too much colloidal silver and eventually died of heart failure. Watch out for the Asian patent medicines on the far right. Many of these contain arsenic, cadmium, lead, mercury. Be careful of that. If you are on a life-sustaining medication, again, those enzyme activators, there's a lot of anecdotal information. There's very poor, well-defined clinical trials. But if you are on any life-sustaining long-term medication, cancer, autoimmunity, organ rejection, et cetera, heart, make sure you're engaged with your physicians and pharmacists so they can help you when you're choosing these products. We always want to keep you safe. Okay. I'm going to try to go through some of the questions. There are many, 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 many. I hope that some of that slides, it was not meant to take the place of detailed clinical information, but it was meant to really step back and discuss with you and help you become a safe and better consumer, and think about engaging with your medical professionals about testing and understanding where are my values, what should I be taking. Are there any burning questions, or should I just run through some of the questions that I have?
I have a few that we got in the chat box throughout the presentation, if you would mind taking a couple of these ones.
Okay, go right ahead.
All right, so one of our first questions was, where can you find the certificate of analysis for a supplement?
So the COA, so you're probably not going to get the COA, but you are going to get what we call the QC, the quality control testing information. So the manufacturer, if they're a good manufacturer, that manufacturer should have that available. So again, depending on where you're purchasing, many people are purchasing online. I encourage you to, call that manufacturer and say, hey, if it's a supplement that you really like, for example, curcumin here. A lot of people ask me about turmeric and curcumin. I gave you two labels here of a company that I know does quality control. If you're going to take curcumin as an anti-inflammatory and you're going to take it for 6 months or a year, it's good to say, hey, call Vital Nutrients and say, you guys doing quality control on this curcumin? And if so, Dr. Secor asked, do you have that quality control information available? You can ask them and they can send it to you. That's a really good indication that it's available. So it's not on the label. It's going to be available by the manufacturer. Did I answer that question?
We have a couple common questions that we got, which was, what is the type of testing done to determine the deficiencies, and how would you know if you needed any supplements?
So in each of those top 10, I tried to list for you a number of symptoms that people commonly have. Mm-hmm. But, if you step back and just think about, I will say 90% of my patients know if their lifestyle is optimal. They know if their diet is well balanced. They have a feeling about their digestion, their sleep, their energy, their mood. So, you really have to do a self-evaluation and say, am I living my best life at this time? Do I feel that I have a well-balanced diet? Do I feel that I'm sleeping? My energy's good. Am I having any symptoms of concern? Fatigue, decreased concentration, bowel issues, numbness, tingling, etc. So again, if you're walking around and you're doing your 40 or 50 hours and you're sleeping your 7.5 hours and you're exercising your 120 to 150 minutes of moderate to intense exercise, followed by your walking and strength training, if you have all that knocked and you're feeling good, it's likely that you may not be deficient in anything. But if you are not optimal, then you have to ask yourself, what am I doing? Am I missing large categories of food? Am I doing fish and healthy things? Again, vegan and vegetarian, that lifestyle seems to be healthier for heart disease, cholesterol, diabetes, weight. But those folks commonly have B12, B1, iron, ferritin, D deficiency. So, we can't do a full intake, but you guys are smart. Do a self-assessment, do the lifestyle assessment and say, where am I? Am I optimal? And then think about, having a conversation with your provider and say, I'd like to check some things. And hopefully she or he will engage you and say, yeah, that's a good idea. I hope that answered that.
Yes, thank you. We had another quick question with someone asking about vitamin D in high quantities. Is that something that can cause kidney stones?
So it's a very good question. More is not better. Vitamin D ranges 30 to 100. 30 is your low, 100 is your high. 31 is definitely not optimal. So 30 plus 100 is 130 divided by 2 is 65 is the mean. So when I think about optimal levels, I'm thinking 50 to 65. When you're in that mean of 50 to 65, which is the optimal range, again, if the low is 30 and you're 31 or 32, ask yourself, is that optimal for me? If it's 30 to 100 and you're 90, 100, usually that is too high. So again, if you're in that mean of 50 to 65, I do not see an increase in kidney stones as long as we're doing all the other things that we need to do in our life, hydrate well, etc. I do see people with values over 100, 140, 160, and my job is to decrease their vitamin D quickly and make sure it falls within the mean. So more is not better for any of these. And I didn't discuss excesses, but just as those top 10 I see deficiencies, I also see excesses. With the iodine, I did mention that iodine excess is also potentially dangerous. So What do? Test, dose, retest. When I test, I have you go off all supplements for 3 days. I don't want to know what you just ate. I really want to know what your baseline levels are. And if you do 3 days without, then you have a consistent testing parameter so you can assess that every time. Next.
We had someone ask, what is the 10-to-1 ratios or the different ratios that you see on some labels mean for different extracts?
So it's a very good question. When we talk about extracts, standardized extracts, there are different kinds. There are fluid, standardized, but generally that means the ratio of extract to raw material. So if you are going to put a pound of something in a liter of water, well, that would be we're mixing our metaphors, 1,000 grams to a liter. So that is your weight to liquid ratio of your extract. And so it's important to know what your extract is. Obviously on the screen, we have a standardized extract. So for that curcumin on your left, that's 1,400 milligrams, that curcuma was extracted to 8% of the active ingredient or curcuminoids. So you can have so think about a tea. You're making green tea at home. It's 1 tablespoon per 4 cups, I'm guessing. You steep it 1 to 5 minutes. So that will give you a certain amount of green tea ECGC. If you put 15 tablespoons in that 4 cups, it would be a much more concentrated extract. So it's that ratio of water to raw material you're putting in, which eventually will give you either a dilute or a much more concentrated end product. Next.
We had someone ask about on the label there where it says other ingredients on the bottom. Are there any ingredients that sometimes can be in there that are a red flag or something that we should avoid?
There are a number of them. I have, I don't know if I included in my tables. I have a number of tables when I wrote that lovely chapter last year on added components. If I don't have it in here, I have a whole table on that, so I can obviously give that to you. But yeah, there are lots of things. You know, it's common to have binders, fillers, talc, dyes, additives. You know, when I talk about, somebody had asked about, sorry, I'm going fast. Somebody had asked about pre-workouts, and this is one of the pre-workout products. And you can see that this one has other ingredients: silicon dioxide for whitener, artificial flavors, sucralose, which is a sugar alcohol that people have digestive components on. This one has red number 40, blue number 1. I'm not a fan of dyes. I would rather have a product without dyes. Many docs say it doesn't matter if you have dyes. Well, I have kids, patients who react to dyes. So again, other ingredients could be fillers, they could be binders, they could be artificial flavors, they can be sugars, they can be dyes. I try to get a product with the least amount of additives as possible. Next question.
Any supplements that can clean your colon or cleanse the body?
That is a great question. When I think of cleanse, before I turn to products, I do a 2-week diet reset or a 4-week diet reset with people. So just remember, just changing your food is a cleanse. If you're used to having highly processed food, if you watch Super Size It, any of you who watch Super Size It, that was that documentary where the gentleman ate at McDonald's for 1 month. And if the McDonald's asked him to supersize it, he would. And so you should look at that, because a cleanse can be removing all processed food. A cleanse can be going on a plant-based Mediterranean diet. A cleanse can be on making sure you're doing your 80 ounces of water every single day. A cleanse can be exercising to the point where you're breaking a full sweat 4 times a week so that you're opening up your pores and you're sweating. So remember, the body detoxifies in several ways: sweat, through our colon, through bile and liver. And so when I think cleanse and I'm customizing it, I'm thinking cleaning up the diet, adding fiber, adding all the things that you might be missing. What's fiber? Nature's broom. So adding soluble and insoluble fiber, which we did in our nutrition. I think we had a couple of handouts on fiber. So I don't jump to supplements. I do start with lifestyle, making sure that that's working. If you put a potato in the tailpipe of your car, do you think your engine is running optimally? So sometimes you have to make sure that, lifestyle's on board. And then, yes, there are things I use like fiber and milk thistle, and I can send some stuff if it's of interest, but there are 2-week cleanses that I do, 4-week cleanses. Many of my folks, 2 weeks every quarter, will do a kind of a dietary reset that involves foods, exercise, hydration, and making sure, because after about 3 months, usually most of us are off of our plan. So what I try to do for most of my folks and myself is, the first 2 weeks of the quarter, I try to consciously reset. I try to make sure, am I sleeping, exercising, am I having a well-balanced diet, so that I am doing incremental care as opposed to having to do heroic intervention. So I'm happy to send you something offline on some of the things I use. Next question, couple more. I got about 7. I got to a quarter after.
We had a couple questions come in about collagen and collagen peptides, the collagen powder. What is your opinion on that?
So I'm a fan. And, we used to get collagen, if you have some of the more mature audience, the old Knox gelatin, right? So when we think of collagen, there's a couple of different components. There is animal-based connective tissue collagen. It's in the glucosamine chondroitin, literally Knox gelatin, right? Gelatin is collagen. Many traditional cultures, or my wife's Polish. They make zimnonogi, they make galaleta. These are foods that are high dense collagen, and so historically, many of the cultures had collagen naturally in their diet. So when we think of collagen as a supplemental form, there can be animal-based, beef-based, cow-based, etc., or there can be type 1, type 3, which is marine-based. And so many of my folks who have digestive issues, many of my folks that have hair loss, fatigue, they've gone through radiation, chemotherapy, surgery. When I think about rebuilding them, I will commonly use collagen for 3 months, the isolated collagen extracts. And again, usually it's about 10 grams of protein. It's about 40 calories. 2 scoops is about 80. And again, that's not excessive to your overall diet. And I'll usually put that in like a smoothie. If I'm having somebody rebound from a significant illness, I am more cautious as a daily thing for a month or 2. We have to watch kidney function. We have to make sure the kidneys are functioning well and we're hydrating. But yes, I'm not a fan of every day. I'm a fan of looking at the condition, stabilize someone, and then I'm a big fan of 3 times a week.
We have another question about melatonin. Is it safe to use every day? I know there's been conflicting things about melatonin.
So it's a really good question. Melatonin is a hormone that affects our circadian rhythm. We started using melatonin early on when people were traveling. Concord, you go overseas, your circadian rhythm was off, and so you would use that to reset. And it's an important thing. I generally, if I'm considering resetting the circadian rhythm for sleep, I will tend to use less than 1 to 3 milligrams only. And I'll use that in the 30 to 40 minutes before the time you wish to go to sleep. Melatonin is designed not as a sleeping pill. It is designed to help you reset your natural circadian rhythm. So if you have a crap sleep cycle and you go to bed at 9 and midnight at 1 and 2, and don't take melatonin as a sleeping pill because you're trying to retrain your circadian rhythm. I tell folks, take 30 days. I have a sleep hygiene handout. Work on good sleep hygiene. Do the low food, do the better temperature, do the air circulation, do the no Fox News, CNN, do the no electronics. Set your environment up for proper sleep. Then, if you want to use melatonin, use 1 to 3 milligrams for 30 to 60 days to retrain your circadian rhythm. If it doesn't work in 30 to 60 days, then discontinue it. But I only use it when I'm working on fixing the sleep lifestyle. I don't use it as a sleeping pill because you're kind of working against yourself and you're retraining a poor sleep habit. Does that make sense?
We got another one on about CBD and how that is as a supplement.
CBD are cannabinoids. Obviously, we know that medical marijuana and CBD now is exploding. And so important things to realize: the difference between THC and CBD. Tetrahydrocannabinol is that mood enhancing component of marijuana. Hemp, which is low THC, generally contains CBD, which is the mood, the anti-inflammatory component or the modulating component. So when you go, and if you have a medical marijuana script, or you go to Massachusetts or wherever and you buy, medical marijuana, you are getting THC and CBD combined. And in Connecticut, right, we're migrating from medical use to wider sales and commercial use. And you just have to know, is this a THC, a CBD, or a combined product? If you're not looking for the mood altering component and you're looking for the CBD component, and then just realize that it's still like the wild, wild west. I usually tell my folks, if they want to try a CBD product, get a good standardized extract, usually in oil and dropper form, and look at the milligrams they're getting and titrate it. 5 drops a night if you're using it for sleep. If you're using it for anxiety or mood during the day, go low and go slow. 3 to 4 drops in mid-morning, 3 to 4 drops mid-afternoon. Some people will get fatigued. So again, what is my concern? Keeping you safe and functioning wherever you are and whatever you have to do. So in general, CBD is generally safer than THC. It has lower side effect profile. Many of my folks benefit from a little less anxiety, a little better mood, a little less pain. So those are the things to consider when you're considering CBD. Sorry about that.
Great.
Next question. Got time for like 2 more.
Okay. The most recent one was, are there any absolutes that you would recommend for type 1 diabetic to take or not take?
I don't know why they're calling me. So type 1 diabetics, obviously that's a big issue. We're not necessarily worried about, if it's insulin dependent type 1 diabetics, our concern is still the secondary effects of excess or low sugar. And so with my type 1 diabetics, I'm not using supplements as a first level, because usually their diabetes is being managed with their GP and their endocrinologist. I'm usually asking the question, how is your lifestyle? Are you strength training? Is your diet good? Are you sleeping? Are you hydrating? Once the lifestyle is kind of managed, again, strength training is huge, because many of our diabetics forget that even if their blood sugar is well controlled, having strong, healthy muscles and core will still help them upregulate those receptors and utilize that excess sugar as fuel. That being said, I do look and say, where is this person in their health trajectory? Are they experiencing any of the secondary side effects of long-time exposure to high sugar? Do they have neuropathy? So it's hard to say, hey, here's a type 1 diabetic, here's what I would do. we really have to say, is this a healthy type 1 diabetic otherwise? Do they have a tight lifestyle? Are they doing everything they need to do as the rest of us have to maintain otherwise health? Or are they experiencing additional neuropathy? So, there are some things that I use, acetyl L-carnitine, alpha lipoic acid. I will use certain things as trials to ask the question, does this help your neuropathy? Does this help your eyes, et cetera? So I don't necessarily have a blanket statement, but we do care about neuropathy. We do care about excess sugar. We do care about eye health. So, I really get into the beta carotene, zeaxanthine, zinc, selenium for the eye protocol. I really am focused on, lifestyle and some of those other safe, otherwise benign things like alpha lipoic acid, acetyl L-carnitine to support neuropathy if that is present.
Great, thank you. All right, you got time for one more?
One more.
All right. This one was questions about electrolyte tablets. And if you're an active individual and you're sweating daily, are those safe to take daily?
So it's a really, really, really good question. And there are, when we think back to some of the slides I gave you, I went over on sports performance. If you're concerned about electrolytes, try to find a brand, and I'm not going to talk about any, particular brand, but when you look at your labels, you usually want to see sodium, chloride, potassium. Usually you want to see a combination of trace minerals, sodium, chloride, potassium, magnesium. There might be some zinc, some vitamin C, but I don't want to see a lot of the other stuff. I don't want to see dyes, additives. I don't want to see sucralose. Look for those clean ones that you can utilize. Some of my patients will use fruits, they'll use vegetables, they'll do there are ways for you to get natural electrolytes in your food. And if you do have a well-balanced diet, you probably are getting those. If you do a recovery shake, for example, and you do, like me, a couple of cups of blueberries, blackberries, raspberries, a banana, I use a high potency multi-powdered 3 times a week. So, depending on what you're doing, yes, you want to put back in those electrolytes in a high quality product. You want to avoid putting in many of the other things, like this pre-workout label I have up. It says 0 stimulant pre-workout. Well, this has caffeine in it. This has green tea. It has coffee. It has, so, I don't know why it's a 0 stimulant pre-workout product. It contains caffeine. So my point is, look at your product. Does it just have what you want in it? Or does it have a lot of extra stuff that may not be needed or be potentially harmful when you're just trying to get yourself good electrolytes? So look for one that doesn't have anything extra, and then, use it judiciously.
All right, thank you so much. Everyone, this presentation was recorded and we will upload it to our YouTube channel so that you can go back and review this as well. Same thing with the slides. Dr. Secor has provided us with the slides, so you'll receive an email with all of these. There's also a link in the chat box to go in and ask any additional questions and leave a review, leave us some stars, how you guys enjoyed the presentation. And thank you guys so much for joining today. And thank you, Dr. Secor, for a wonderful presentation.
My pleasure. Have a great, safe week. Talk to you soon.